After heart surgeries like angioplasty or bypass surgery, people think their problem is completely gone, but that is not true. So after such surgeries, so there is a greater responsibility on physician like me to educate you so that you won't land in similar problems again, as well as similar responsibility is there on you to take care of you regarding many issues which I am going to discuss subsequently, so that you won't land in same problem again and again. So principally these measures, that is a post angioplasty or post bypass measures, are very important to prevent two things. One is to prevent stent occlusion. So that is the stent which is kept in you can get occluded if we don't take proper measures subsequently, or graft occlusion, that is if you undergo bypass surgery. That bypass grafts usually work for 15 to 20 years, provided we take adequate measures. If you don't take, then there is every chance these grafts can get occluded again. And the third reason is formation of similar blockages in other vessels. In angioplasty and bypass, we treat particular vessels which are already occluded, but there is no guarantee that other vessels don't get occluded in future. But if you take this care, post angioplasty or bypass surgery care, we can prevent this occlusion formation in other blood vessels, and we can prevent recurrent symptoms and recurrent surgeries on you. What are the important aspects of this post angioplasty or bypass care? Number one, compliance to medications prescribed by us. So you have to take medications regularly as prescribed. Number two, diabetes control. If you are a diabetic, your diabetes should be kept under control to prevent further complications. Number three, hypertension. So if you are a hypertensive, and your hypertension should be kept under control to prevent similar problems again. And control of habits. So if you are a smoker or alcoholic, so we have to control those habits to prevent recurrence. And diet modification. So our specific diet modification will help us in preventing recurrence of similar issues and in preventing similar surgeries again. The last one is physical activity. If we do physical activity as prescribed, we can prevent recurrence of such issues again. So medicines are very important in post angioplasty or bypass surgery care, and we prescribe different kind of medications with different purposes. For example, the most important drug which you should not stop after angioplasty is antiplatelets, and they are like aspirin or clopidogrel or prasugrel or ticagrelor, which we call as Brilinta routinely. So these medications are very important in preventing stent thrombosis. That means the stents which we have deployed can get occluded suddenly by blood clot formation, and these drugs prevent blood clot formation. By preventing blood clot formation, it prevents stent thrombosis as well as similar occlusions formation in other blood vessels. So at any cost, these medications should not be stopped by post angioplasty patients without cardiologist consultation. If you stop, there is every chance that your stent can get occluded and it can create an emergency. And that chance of stent occlusion is only 10 to 15% if you stop medication. It's not 100%, but still we should not take such risk knowingly. And there are medications which we give to treat heart failure. So after heart attack, so part of the heart muscle will stop contracting, which results in pumping dysfunction of heart. So that causes progressive dilatation of heart, that is, the heart will become like a balloon, and which results in further pumping dysfunction in future. To prevent such a remodeling of heart, we give certain medications like beta blockers and ACE inhibitors, which you have to continue regularly so that it prevents remodeling of heart and it prevents further pumping dysfunction in future, so that you won't land in heart failure like situation in future. And there are medicines which are prescribed to control your diabetes if you are diabetic, and hypertension if you are hypertensive, and sometimes even cholesterol control. Diabetes control. See, if you are diabetic, so your chance of having similar problems in future is significantly more than a non-diabetic patient. But if you control your diabetes properly, so your chances of similar problems will come down, and it may become equal to a non-diabetic person. And after such surgeries, the sugar control is very important, and the goal of therapy is to bring your fasting blood sugars below 140 and post-lunch blood sugars below 180 and HbA1c below 7. HbA1c is one marker which gives 3 months control of your blood sugar. If we can bring your sugars below these limits, chances of recurrence of these problems will be less, as well as chances of diabetic complications also will be less. So if your sugars are already under control, we'll continue your same medication which you are taking as before, and will follow you once in 3 months. But if the medication is not sufficient, or if your sugars are not under control, then we need to titrate your medication. So for that, we have to check your sugar levels once in 2 weeks. Depending on that, we'll step up your medication, and when sugars come under control, then from that point you can come for follow-ups once in 3 months. But till sugar comes under control, so once in 2 weeks you have to come to hospital, and you have to show your fasting and post-lunch sugars to clinician for titration of medication. And in diabetic control, medication is one important factor, as well as diet and exercise. Diet and exercise are equally important. So if you follow your diet as advised by your dietitian, and if you follow regular physical activity, your requirement of drug doses will be less. So we can bring your sugar under control with low doses of drugs. And when I use low doses of drugs, chances of drug complications also will be less. But if you don't follow diet and exercise, so we have to up-titrate medication, we have to increase doses, and by that we may land even in drug-related complications. So better follow diet as well as physical activity and minimize your medication. If you are hypertensive, that means high BP patient, so then we have to bring your blood pressure under control. And normal goal level of blood pressure for patients with heart surgery is 130/80. So we have to bring your blood pressure below 130/80 by titrating medication. If your blood pressure is already under control with your pre-existing medication, generally we don't change your medication, we'll continue and will follow you once in 3 months. But if your blood pressure is not under control, then we have to titrate your medication, and once in 2 weeks we have to check your blood pressure depending on blood pressure status. If required, we up-titrate your medication. So till your pressure comes under control, so we need to check your blood pressure once in 2 weeks for adequate titration. Once it comes under control, so we continue same medication and we follow you once in 3 months. In blood pressure control, along with medication, diet and exercise is equally important. if you follow diet as prescribed by dietitian and if you follow physical activity as prescribed, your medication doses will come down and chances of complications, that is medication related complications, also will come down. So along with medications, diet has a very important role in your management, especially in post-angioplasty and bypass surgery, to prevent recurrence of same problems again. If we follow diet as prescribed, so we can bring your diabetes, hypertension under control with low doses of medication. We can bring your cholesterol level under goal level with low doses of medication. So overall, the requirement of medications will come down drastically if you follow diet as prescribed. And diet also reduces chances of recurrence of similar heart problems in future. And that's why I strongly recommend all patients to follow diet as prescribed by dietitian. Physical activity is another prevention measure which is neglected by many patients. So physical activity is as important as your medication and diet. If you follow regular physical activity, it reduces requirement of drugs to control blood pressure and hypertension as well as cholesterol, and it reduces chances of similar problems again. And among physical activity, either walking, jogging or cycling or swimming, which suits your needs, can be selected, and which you have to do at least 30 to 40 minutes per day and at least 5 days a week. And that is the adequate physical activity. If you follow that adequate physical activity, so it drastically reduces your chances of having similar problem in future, and it drastically reduces your drug requirement to control your diabetes or hypertension or cholesterol.